Good morning. I'm Matt Graves, and beside me is my wife, Melissa. We'd like to thank you all for attending today. I'd first like to thank Nebraska Medicine and Children's Hospital and Medical Center for their trust in us and ultimately their partnership. Before I go any further, we'd like to show you the video we've created that describes why the foundation is so important to us and includes testimonials from some of the families Lane has been able to help.
She doesn't know she's sick. All she's ever known is living in hospital, so she's happy as can be.
I felt a lump in her abdomen that kind of felt odd to me. So took her in and they found a tumor in her liver.
Jonathan was actually 2 months old when they told me that he was going to need a multi-organ transplant. And 9 years later, we hadn't received the call.
Transplant's hard, and it's not quick, and it's really not an easy process.
And for children, that process can be even more diverse and complex because we're dealing with the dynamics not just of a patient, but of an entire family.
We are asking families to commit for 6 to 9 months for a transplant recovery, and that's if everything goes well.
Your first thought is the medical challenges that your child is having to go through, and that's the challenges of being uprooted from your home and your job and the financial situation, because outside these walls, the world does go on.
We cry behind doors thinking about the stress back home, trying to be strong for our child, but then inside we're kind of breaking down because we don't know if we're gonna be able to pay our utilities back home.
We created Lane Thomas Foundation to help these children that are going through organ transplant. We found a need that no one was helping these families.
The whole family is uprooted from their home, and most times a parent, and sometimes a single parent, has to leave their job.
So our job is to make sure we're taking care of any expenses that they have while they're going through the transplant, as well as if there's any expenses that they have at home, so they really can focus on their child.
We've had to travel 900 miles away from our home. So it's a lot of living in hospitals.
I have had to pretty much quit my job and be here for Evie. You can't think about anything else.
The Lane Thomas Foundation saying that we're able to help you pay your rent, it just took a burden off my chest.
We don't have to have that worry in the back of our minds of how are we going to pay our bills this month while we're here. The Lane Thomas Foundation has made it possible for us to take care of Emery.
Nos ayuda mucho porque Kevin recibe más apoyo de la familia y Kevin siente que estamos todos juntos y él se recupera más pronto de lo que uno piensa.
I know that when her family is here, that is her strength, and she draws on it.
We're making a difference in these families. We're helping these children be happier, keeping these families together, and that means a lot.
They truly don't know what impact they're making on our lives and people that are in our same situation.
The Lane Thomas Foundation has helped me focus more on his medical needs.
Now that Emery has a transplant, she'll grow normally. She'll get to learn to walk and talk and play like a normal 2-year-old.
It's not a cure, the transplant. There are always going to be obstacles.
I just hope for him to be healthy as possible.
Lane had a special light about him. Every time he walked into the room, he lit it up. So his legacy should really be taking that love and the light that he had and bringing that to other families so they have hope. You're not only helping these families, you're helping their siblings, you're helping everyone that's associated with this child's life. These children deserve a second chance, and with your help, we can make that happen. Melissa and I created the Lane Thomas Foundation to honor our son, Lane. Lane had a very special light about him, and we promised him at his wake we would turn this tragedy into good for many families. Lane loved children, and it was very important to Melissa and me to select a mission where we could try to prevent other parents from knowing the pain of losing a child. The mission of the foundation is dedicated to supporting families of children needing life-saving organ transplants. We help these families by providing financial relief for non-medical expenses they incur because of their child's transplant. We also look to help save children's lives by creating awareness and education programs specifically designed to increase pediatric organ donation. We want parents to know without judgment that if they decide to make the ultimate decision to donate their child's organs, they will prevent other families from knowing their pain, and we believe there isn't a better way to honor a child than saving others. The Lane Thomas Foundation has received our own 501c3 public charity status, and today we officially launch our new website, www.lanethomas.org. We didn't realize when we selected pediatric transplant that the need was so big. Most of these families are not receiving help and have significant financial pressures that Lane's Foundation has been able to ease. These families are usually in Omaha for several months, if not longer, and often have to leave their jobs. We want to keep these families together while they're trying to save their child. Our goal is for them not to worry about anything other than getting their child healthy. I'd also like to thank the amazing board that has graciously volunteered their time, energy, and experience to help us create the foundation. We are also thankful to the families, many that are here today, that have agreed to work with us on the video and share their experiences with us. We've already helped 15 families this year, where 13 of these children have come from out of state to receive care from these amazing medical teams. Without the leadership from Dr. Gold, Dr. Mercer, Dr. Langness, and Manny Flaster from Nebraska Medicine, as well as Dr. Aziz Khan, Dr. Duncan, Kathy English, and Barb Rossner from Children's, we would not have been able to help so many families so quickly. Now I'd like to introduce Barb Rossner, Heart Transplant Coordinator at Children's Hospital and Medical Center.
Thank you guys for coming today. First and foremost, I'd really like to say thank you to Matt and Melissa on behalf of Children's and all of the pediatric heart transplant families that we have served. We thank you for your willingness to help, for your dedication to us, for your strength and your courage. It's been truly amazing, and it's been a blessing to work with you. So thank you for including us in this process and this journey with you. When I first met Matt and Melissa a little over a year ago, we talked about organ donation and organ transplantation. We talked about the basics. What does it mean to go through this process? And it was a learning experience for all of us. And through our discussions, we learned a lot about what was missing and what these families really needed. And what they really needed was some additional support that we just couldn't provide as a medical team and that their insurance companies just couldn't provide. And so it's been a true blessing to have this foundation established to help these families with the emotional, financial, and social stressors of transplant. They saw a need, they stepped in after their horrible tragedy, and were able to, we're able to address that need. They're committed to helping these families, they're committed to helping these children, and I think more importantly, they're committed to helping prevent other children from losing their lives. They want to educate the public, they want to educate parents, and they want us to talk about this before it becomes an urgent need. They want us to talk about us as parents, what we would do in that situation. Unfortunate, tragic things happen every day, and at that time, when you're faced with a discussion and the decision, should I donate my child's organs or not, it's a tough thing to do at that point in time. So part of their mission is to encourage people to think about it sooner, to talk about it before you're in that situation. They really want us as a public and as a community to think about that need and how many people that can be helped through one person's decision to donate when they have a tragic experience. Our program at Children's is really young. We've only been transplanting since 2013. We've had 19 transplants. We've had families that have been helped by the Lane Thomas Foundation. One family, unfortunately, their child passed away, and that's a reality of transplant. Kids die on the wait list, and that's part of what Matt and Melissa are trying to prevent. Their foundation, the goal of their foundation is to save every life that they can. And so I think the education piece is critical. The other family that has been helped has been tremendously grateful, beyond words. And due to distance, they're not able to be here with us today. But they want me to make sure that Matt and Melissa and everybody knows how thankful they are for the help and support that they received. Mom had to quit her job. There was countless miles traveling back and forth. The financial support has made it so the family could be together through all the trials and tribulations, all the ups and downs, and all the stresses of their daughter's transplant process. I, as a parent, can imagine losing a child. I, as a parent, can't imagine being asked to donate my child's organs. And I really appreciate the fact that Matt and Melissa are willing to encourage us to have those tough decisions and to have those tough discussions and make those decisions. Without transplant, my heart kids don't have any other options. And I am so appreciative for the foundation, as are my families, for their mission and their vision to help financially and emotionally support these families. All of us at Children's have felt incredibly honored to be involved in the process and the evolution of the foundation. It's had a tremendous impact on the families that they've served, and it's going to have a tremendous impact on more families locally and nationally. I'd like to now introduce Dr. Alan Langness, the Chief of Transplant Surgery here at Nebraska Medicine. He's also seen firsthand the impact that the Lane Thomas Foundation can have on families. Thank you.
Thank you. Well, good morning, everybody. This is truly an amazing day. Having the opportunity to work with Matt and Melissa for less than a year for sure, but getting to know each other, understanding where they're coming from, their perspective, their compassion, their true, appreciation for the challenges that so many families and their children struggle with during these incredibly difficult times in their lives has really been remarkable. And so I feel very grateful to be a part of this and really appreciate everything that the two of you have done and to take the situation and make it so positive. So there's a few words that I have to say. Well, at Nebraska Medicine, I think many of you appreciate the fact that we've been doing pediatric transplants for quite some time. We've done, 7,000, 8,000 transplants in total over the past 30 years or so. And we've also done quite a few in children. And I've been very fortunate to have a front row seat to that experience for my entire professional career. And now we're reaching about our 900th pediatric transplant. And so it's really been quite an experience for me professionally and personally. And seeing this front row here of our recent recipients of transplants and familiar faces and seeing how wonderful they look and how rewarding it is for the patients and their families. But most importantly, I think that one cannot underestimate the impact that having a child that the doctor tells you that the only way to save their lives is through some operation that will depend on the kindness of strangers, which is organ donation, and the wait, and then the challenges of having that operation and the struggles that often are associated with that transplant procedure. Because despite as good as we think we do with all of this, it's still a lot of work for everybody, the physicians, the nurses, the patients, and certainly their families. And as part of that, some of the burdens that the Lane Thomas Foundation wants to unburden these families with, which in particular are some of these financial circumstances, were completely unappreciated by so many people for so long. And I think that we'll hear testimony from many people about the huge impact that can have on them and how it allows parents to just be parents. Let them just take care of their sick child. Those things are incredibly important. And to have to try to navigate how you're going to pay your electric bill, how you can make a house payment. There was a little girl who was here. I'll just have one brief story and then I'll stop talking. I can talk for hours on this stuff. But there's a little girl, I think her name was Safira. And she might have been from Louisiana. There's a Louisiana thing going today. And I will say that LSU is my second favorite football team. So we were making rounds, and Safira had been here for a while, and it was actually not the father, but the grandfather was here because of the complicated family dynamics, and it was his job. That was his responsibility to care for this little girl. And he was a guy of a certain age, and he didn't quite have all the things in place to deal with all the daily struggles of caring for this little 2-year-old or 1.5-year-old who had this transplant. And so it was tough for him. He was very devoted, very committed. And so I remember I said to him one day, I said, hey man, we'll take good care of your granddaughter. Just take the day off. Go out, go to the movies, get a pack of Twizzlers, and just relax. And you just got to decompress a little bit so you can do better. And he goes, Doc, I'd love to, but I haven't got the money. My wife's still back home working. I can't work. She's got to take care of, make the house payments. So I don't feel right about spending money to go to the movies and buy a pack of Twizzlers. So it's just like stuff like that. And I also suggested he could get a haircut. And he said he didn't have any, not that I'm any expert on that topic, but he suggested that he didn't have money for that either. So it's just stuff like that is just so little and has such a huge impact. So with that, I would just like to share with you again my gratitude for your commitment and my privilege for being able to help participate in this. And so with that, I get to introduce our next speaker, and I want to make sure I get this right, because if I don't, I will be in big trouble. All right, Jenny, where is it? All right, so we have a celebrity here on the front row here, and for those of you who don't know Kylie, she's been around for a little while here, and she's had a big transplant, and she's doing quite well, and she's very, very pretty and very, 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 very charming, I might add. I like the ribbon and bow in your hair. But I'd like to introduce her mom, Joan Broussard from Louisiana, who's here to say a few words about her experience and how the Lane Thomas Foundation has affected her and her family.
Matt and Melissa, I just don't know of any words that I could possibly say could bring justice to what you have done for us. Like Dr. Elena said, we are from Louisiana. One of the many faces that you'll see, one of the many parents who has a child here that is involved in the pediatric transplant program. Just a little background on us. Kylie has been a patient of Nebraska Medicine for 10 years. Her first transplant was in 2007 as an 18-month-old baby. And our second one, which learned a lot along the way, was in 2016, where she received a liver, a small bowel, and a pancreas. Normally they say, prepare to stay for 6 to 9 months if everything goes well. Our first transplant did great. Our second transplant, we've had a lot of complications with this one, including steroid-induced diabetes, deep vein thrombosis, several acute rejections with her organs, and our most recent diagnosis is PTLD, which is a cancer that's associated with the transplant. So we've been here a while, and we're ready to go home. Home is 900 miles away. I am one of those single parents, and so I don't have the luxury of just quitting my job, and I'm very fortunate that my job does work with us. That is her medical care or her health insurance to pay for just the medical stuff. But then we do have those expenses. The world does go on outside these walls. We have houses and car payments and insurance, and I have 3 other kids. She's my baby. So I do have to travel 900 miles back and forth every 2 weeks. I'm fortunate that her dad and I, we tag team. Every once in a while I have to bring my mom up here, but I make sure that Kylie is never alone. It takes everything that you have when your child is on a vent and you have to leave to go to go back to work just to make sure that they're going to get what they need. And my heart, I leave my heart here. I live by my phone. I've missed some phone calls sometimes. I do sneak away to the Nebraska house every so often to try to get a little bit of sleep. And I'm one of those bad moms that I did miss her scope one morning. They just couldn't wake me up. But you know, it's a learning process. Like you learned from the video, transplant is not the cure-all. Unfortunately, it is the one way to save their life. But with it, you trade one medical disease for another. As the parent or caretaker, you basically learn how to become a nurse, a doctor. I mean, anything that I'm a teacher by trade, work with special needs children, and I think my career has prepared me for Kylie. I have seen a lot of stuff, but never could I have imagined the journey that we would take when she was born with malrotation and volvulus. We have become big advocates of organ donation awareness. The Lane Thomas Foundation has made it possible for me to stay longer with my child. They have helped ease some burdens. Our rent got paid. I was able to travel back and forth. They've helped me. And like I said, I just don't think there are enough words to express out of such a tragedy that you want to help for us. And I just want to thank you from the bottom of my heart. And I'm sure there's a lot that I missed. I'm not the most eloquent speaker in front of a bunch of cameras, and I just hope that I can do it justice, but I just want to say thank you on behalf of everybody. Just thank you. Thank you.
Melissa and I would like to thank everyone that has made the time to be with us today, and for everyone that has supported us and Lane's Foundation. We know there are so many great causes to support, but Melissa and I hope we have shared with you how you can make a real difference in these families' lives. Please consider supporting the Lane Thomas Foundation by donating at www.lanethomas.org. You can also donate by texting LANE to 74121. Thank you very much for your support.
Yes, ma'am.
I'll ask a practical question then. Be interested in the world here. Given the foundation's now established, do we know how much is available? How will this be sustainable after that? Keep helping folks.
I don't think I can answer that question.
So how long on average do your patients do transplant? Can stay? I know there's not an average necessarily, but roughly?
So it depends. Obviously, depends on the type of transplant they receive. I think if you're a child of depending on your age, like a 10-year-old undergoing a kidney transplant, hopefully will be in the hospital a weekish. If you're a 2-year-old having a liver transplant, you'll probably be in the hospital 2 weeks. If you're receiving one of these big transplants that some people in the front row have received, which are these liver, small bowel, pancreas, these multivisceral transplants, then the hospitalization is typically a couple of months. I mean, it's a much as you can imagine, a much bigger transplant. And the heart transplant recipients, I suspect,
Our kids also vary depending on their age and how sick they were going into transplant. Our average is between 2 to 4 weeks post-transplant that they are in the hospital. And then if they are lucky enough to be discharged before that 4 weeks, we ask that they stay in Omaha for at least a month to ensure that things are going well.
So that's a really important part of it, that, you know, the hospital experience is one part of it, but it's really a medical experience. And for the children and their families, oftentimes the biggest challenges are when they're discharged from the hospital, but then they're asked to stay in the Omaha area for some time afterwards. Typically, like so for a liver transplant, we tell them about a month from the day of transplant. So then it becomes another bit of it's a challenge for these families to have to navigate their lives in a city that they're not from, and not having the resources to live daily, the usual daily stuff that we have. So that's really another place where the Lane Thomas Foundation can really leave a big mark and a helpful mark on these families. I'm sorry, could you ask that question again?
A child can't sign up as an organ donor the way an adult can on their driver's license. What's the challenge you face when you're trying to get donation?
Organ donation. Right. Well, that's a really important question. I think the challenge is, you know, the families that have to. So for an adult, just to give you some perspective, so we have first-person legislation in the state of Nebraska. So if you sign up your driver's license, it says you're an organ donor, then it's a legally binding document, so that if something unforeseen happens to you, then donating your organs becomes a straightforward process. Either it's yes or no and things like that nature. When something unforeseen happens to a child, then the families have to make difficult decisions under obviously the most challenging circumstances and under great duress. And that is the core of the challenge. How do you get families and people to talk about or think about the unthinkable ahead of time, so that when they're in the midst of these tragedies, these difficult decisions are not easy, but easier to make? And that, I think, is the core issue. And then, of course, the need for organs, if you look at data, I don't want to get too much in the weeds, but the number of children who die relative to the number of children who may require may not be well matched, and so there's issues there. So it's not a straightforward issue, but we can just imagine the challenges the families have to make under those circumstances.
Along those same lines, that's one of Matt and Melissa's really core focuses of the foundation, is really to educate, to make us as parents think about that before we have to think about it. Think about what would we do if that was our child and we were faced with a decision to donate or not. Would we make that decision, yes or no? And I think going back to a year or so ago, having been asked that question, the answer might have been no, suffering a tragic loss. But after learning about the process and learning about children dying and the number of children that could be saved by one donor, I think that answer now would be absolutely yes, we want to donate. But that's because they had time to think and process. And that's, I think, what a lot of families need. And so I think the educational component will be huge to help with that organ disparity.
And that's one thing that we've tried to do through this process to give back. We actually put Kylie's face with that question, what would you do? Would you donate your organs? This is a face. This is a child who was saved by somebody who did make the ultimate gift. And I think sometimes it brings it more to life when you can actually see these babies who are saved, or the babies who are waiting for organ transplant, because it really wasn't something that I thought about before. I was blessed to have healthy children. So we've tried to, through her 10 years, to educate people as much as we can, just to bring awareness.
Good question.
It's a very good question.
I don't know. We have a pretty robust program. If you look at the heart program, the kidney program, the liver program, the small bowel transplant program, it varies from year to year. But I don't know how many children are actually listed, but I'm trying to do a little quick math in my head about how many transplants are done. So I'm thinking 10, 15, 25, 30-ish transplants, all comers, probably about-ish. I mean, I don't know, maybe somebody in the room can correct me if I'm wrong. It's a ballpark, and then there's more than that on the waiting list, obviously. And that really just, and I think we're one of the larger pediatric transplant programs in the United States, particularly for some of the things that we do, and combined with the heart transplant program at Children's. So the need for this demographic, for this area, I think the need is pretty strong, because as you can see, we have patients here from all over the United States. But I think, I don't want to speak too much for the foundation, but I think while their goal is certainly focused, while their efforts have been focused primarily here at Nebraska Medicine at Children's Hospital, I think their goal ultimately will be to reach a much broader audience and to have an impact throughout the entire United States.